Hi everyone, welcome back to my channel. My name is Dr. Nkiruka Bridget at OB/GYN Talks with Dr. Adazion. I'm a consultant obstetrician gynecologist. I discuss everything about women's and children's health on my channel. Sometimes I add men's health to it. Today we'll be discussing amenorrhea. Amenorrhea literally means absence of menses. Menses, absence of menstruation. That's the literal meaning of it. It could be physiological, it could be pathological. Physiological means it follows normal human body system. For example, someone that has not reached puberty, someone that has not started seeing her menses for the first time, will call it menarche. Someone that has not achieved menarche can say that she has not seen her period, so is that amenorrhea? And someone that is pregnant can say that she has not seen her period, which is also amenorrhea. Then someone that has reached menopause, when every other physiological process is going down, the person can say that she's also amenorrheic. Now, that is physiological component of amenorrhea. It can be pathological too. Any other disease that will cause someone not to see her period is known as pathological cause of amenorrhea. So, amenorrhea can be physiological, it can be pathological. Now, for someone who it can be divided into primary or secondary. Primary amenorrhea has to do with someone that has never seen her period. For example, if a woman is up to 16 years and has normal physiological development, he has achieved puberty, that is, has breast development, has axillary hair, that is the armpit hair, and has the pubic hair, that's the private part hair. If those things are present and the girl is more than 16 years and has not started seeing her period, you can say that that person has primary amenorrhea. Or if a girl is 14 years and has not developed any other development, that what makes a woman, there's no presence of breast development, there's no presence of axillary hair, there's no presence of pubic hair, and the person has not seen her period and is 14 years and above, it can be said that that person has primary amenorrhea. And that is about primary amenorrhea. Primary amenorrhea means that the person has never seen her period for the first time in life, while secondary amenorrhea means the person has seen her period and subsequently the period stopped for 6 months. If you count for 6 months, the person has not seen period after it has first happened. For example, someone that has achieved menarche. Remember I said menarche is seeing period for the first time. So if a young lady has seen her period for the first time, has achieved menarche, and subsequently it stopped for 6 months, you can say that this person has secondary amenorrhea. If someone, a normal person, has been seeing her period and subsequently for 6 months without pregnancy, it stops, the person can be said to have secondary amenorrhea. So this is it for primary amenorrhea and secondary amenorrhea. The very first menstrual bleeding of a human female is termed menarche, and for its occurrence to happen, it depends on a lot of things, significantly depends on a lot of things, which include the geographical location of that individual, where the person is located, then the race of that individual, is the person Black American, is the person Caucasian, is the person African, of African descent, and it also depends on the ethnicity. And this further depends on the female biology of that individual, the genetic constitution of that individual, and environmental factor, which also depends on the nutrition of that individual. So a lot of things plays roles for that that first menses to happen. So when there is a problem with any of these, it can affect the occurrence of that menses. Now, the primary amenorrhea I said and the secondary amenorrhea which I said can overlap. Now, I'm going to focus on primary amenorrhea for the purpose of this video. In subsequent video, we are going to talk about secondary amenorrhea and the causes of primary amenorrhea, causes of secondary amenorrhea. So please, if you have not followed me, follow me on OB/GYN Talks with Dr. Adazion. Subscribe to my YouTube page at Dr. Nkiruka Bridget at OB/GYN Talks with Dr. Adazion. I'm also on TikTok and on Instagram with the same name. So let's go on. Primary amenorrhea. Primary amenorrhea, remember, as I discussed before, is the absence of menses for the first time. The person has not seen her period for the first time as a woman. And it can happen depending on a lot of things. The process of menses occurring is a sequence which follows from the brain, what we call the hypothalamus, to the pituitary gland, which now signifies and notifies the ovary to start functioning to produce some hormones, and the hormones will now affect the uterus. So it needs an intact hypothalamic pituitary system with intact ovarian system and intact uterus, normal well-formed uterus, that is the womb, and the outflow that is patent. The outflow patent means that the uterus is okay and that the cervix is functioning well. And now that the vagina is patent for outflow of that menstruation, that is the bleeding that follows menses. So anything affecting any of these compartments will lead to primary amenorrhea, that is absence of menses after 16 years of age with normal puberty, normal female physiology, that is breast development, axillary hair, pubic hair, all of them are present. So, and the person is above 16 years and has not seen her period, that is primary amenorrhea. Or after 14 years, for someone that does not have any of these pubertal features, after 14 years of not seeing her period, the person has primary amenorrhea. So any of these can cause primary amenorrhea or delayed menarche. Primary amenorrhea can be caused by problem with the hypothalamic. For example, if there is any problem that inhibits the release of gonadotropin releasing hormone from the hypothalamic, because the release of that gonadotropin releasing hormones goes to the pituitary gland, the one still in the head, to notify it to start producing some other hormone like follicle stimulating hormone and luteinizing hormone, which will move to the ovaries and cause them to start producing progesterone, estrogen, progesterone that will start preparing the uterus for fertilization, prevent fertilization or cause. And will also help in the development of the germ cells, development of the ovaries so that ovulation can occur, and so that if there is no fertilization, now the uterus will shed its layers as menstruum, and with patent cervical tract and vaginal tract, it will flow as menses. So if there is any problem with the hypothalamic problem, anything that will lead to prevention of gonadotropin releasing hormone will lead to primary amenorrhea, that is absence of menses for the first time. And this could be result of chronic illnesses. The body tends to shut down and say this body cannot handle it, and so the person will present with primary amenorrhea. If there's a problem with what we call extreme weight loss, that could be from anything or even from anorexia nervosa, for those people that stimulate themselves so that they will lose weight. Any body mass index that is while well-nourished children tend to see their menses early. So, and why nutrition is a factor to menarche. So, anything that will lead to extreme weight loss can lead the person to not seeing her menses for the first time. Then there's another syndrome that we call Kalman syndrome. This involves problem with the hypothalamic that will also lead to color blindness, lead to anoxia, the person will not be smelling things. So it's actually a problem, but this can be found out through visiting the hospital and the cause noted and the person treated. So these are the hypothalamic causes of primary amenorrhea. But now when you come to the pituitary causes, where the body produces the hormone we know as follicle stimulating hormone and luteinizing hormone, if there's increased production of what the hormone called prolactin, it may affect the person seeing her period. And this can occur as a result of tumors in that gland. We call it adenomas. When there is micro or macro adenomas producing pituitary prolactin, the hormone prolactin, it will inhibit the body from producing the hormones that will lead to maturation of the ovaries and subsequent menses. So the person may present with primary amenorrhea. Problems associated with the ovaries. If there is what we call premature ovarian failure in that individual, especially when the germ cells, the cells in the ovary are not well developed, so they are unable to send a feedback mechanism to the brain to produce more. So there will be more hormones that will suppress ovarian activity, and that ovary will lead to premature ovarian failure. The person can present with primary amenorrhea, that is inability to see her menses for the first time. This could be as a result of infection like mum pruritus, result of autoimmune diseases like systemic lupus erythematosus, or any autoimmune disease affecting the ovary or the germ cells. It can be from surgically removal of the ovaries in childhood, or things we call endometriosis, when there is implantation of the endometrial glands on the ovaries. This will prevent the ovaries from acting well, and they may lead to premature ovarian failure. It can also be from chemotherapy, radiotherapy as a result of childhood cancer. So this can lead to premature ovarian failure and will lead to inability to see the menses for the first time. Others include gonadal dysgenesis, some chromosomal problem in when that baby is being formed in utero inside the womb. There may be some problem on the X chromosome that will affect the baby from the ovary from functioning well, and the person may present with primary amenorrhea. Then when there is persistent ovarian resistance, the whole ovaries are resistant to the hormone that makes them to ovulate, to cause, to produce, and so the person will now present with primary amenorrhea. I'm trying to bring it to a layman's term as much as possible. These are a few causes of, we call it hypogonadism, things that will reduce the gonads, that is the ovaries, from forming well. So we'll now go to things about the uterus, and things about the uterus result from development as well. So if there is any form of inability of that uterus not to develop well, Mullerian dysgenesis, Mullerian agenesis, anything that will make the uterus not to develop well can lead to primary amenorrhea. Anything that will lead to absence of the uterus can lead to primary amenorrhea. Anything that will lead to outflow tract, maybe cervical stenosis, anything that will just stop the blood from coming out, can lead to primary amenorrhea. And others are include imperforate hymen. You know, baby girls come with hymen. Inside that hymen, that's what is known as virginity. It covers the introitus, the vaginal introitus. However, it has an opening that leaves for the menstruum, especially if the person has not had her first sexual intercourse. So just leave an opening for menses to be coming out. But in some young girls, it is totally sealed up. And even though menses is happening, it is not flowing out. These are causes of primary amenorrhea. Others include genital tuberculosis. When there is reactivation of childhood tuberculosis, the seedlings can be deposited on the uterus, the ovaries, the fallopian tubes, and that can go to healing by fibrosis, and it will lead to outflow obstruction because of the fibrotic deposits and tissues that are formed. So the person may not develop primary amenorrhea. Now, other things include when we have someone that has what we call 46XY. In this person, the person phenotypically, I'm merely looking at the person is a woman. She has a well-formed breast, has beautiful hips, but the supposed lady now has testes in her labia. You have to, when you palpate, you see testes, and they have blind ending vagina. This is the cause of primary amenorrhea. Then others that may affect the ovaries include polycystic ovarian disease or polycystic ovarian syndrome. I've discussed that before. So these are causes of primary amenorrhea. Treatment depends on what is found. So if you see a young girl that has not seen her menses after 14 years without development of pubertal features, or after 16 years with development of pubertal features, and has not seen her menses for the first time, please refer her to the hospital. Whatever that is seen will be treated. Whatever the cause is, the ones that will be treated. The ones that cannot be treated, if it's testes, we'll remove the testes and reconstruct a vagina for the person. Person may not see her period, but she'll have a good sexual life. So treatment depends on what is seen. If it is hormonal, we can give the person hormonal drug. Whatever that it is corrected. For those that will be corrected fully, the person will go on to see her period. For those that will not be corrected fully, we remove the things that will cause problem in future. Because if you leave those testes in the labia, the person may develop testicular cancer from it, and that becomes another issue. So the best is to come to the hospital. The person will be treated, reviewed, and treated according to what the issue is. Now, this is for primary amenorrhea. If you have not subscribed, oh, please subscribe to my YouTube channel. Encourage me, grow this channel. Let's reach the audience, the targeted audience. Now, follow me on Facebook page or at OBGYN Talks with Dr. Adazion. I'm also on TikTok and Instagram. Next time, we'll be discussing secondary amenorrhea, someone that has seen her period for the first time and subsequently it stopped for 6 months. That is secondary amenorrhea. That will be our next topic. Please tune on to the channel as we continue to discuss our medical health. Thank you for watching to this point. If you have not subscribed, please subscribe. Hit the notification button at OBGYN Talks with Dr. Adazion. Thank you and see you next time.